Hi, I am Dr. RIAZ and I work in Aster Medical Center, Hilal branch. Today we are going to discuss about lasers and its uses in dentistry. Lasers are a light and it's not visible to the naked eye. Laser energy basically has photons and which travels in like a wave. The normal light which is lit up in this room, they don't have any direction, so it's everywhere. It's not focused, whereas the laser light, it's a focused light. It has a unidirection, and that's where the changes comes in, and it has its healing properties and is very efficient in killing the bacteria. So today we will see what all the possibilities by which we can use this laser in dentistry. So with these lasers, the treatment have become very quick and it's very precise. It's absolutely painless during the procedure or after the procedure. The most sorted out treatment by most of the patients is the teeth whitening. The teeth whitening is a very efficient procedure whereby your aesthetic has been enhanced. You can get your confident smile back. With the laser teeth whitening, it's very quick, it's non-invasive, and it lasts for a very long time compared to the other methods. The next procedure we'll be discussing is about depigmentation. Depigmentation is like some people have black spots in their gums and it looks ugly when they smile. So the depigmentation is the procedure whereby we use the laser. It's a very minimal invasive procedure whereby we remove the pigments in the gums. Sometimes even local anesthesia is also needed for such procedures. This laser can be used even in ulcers, any mouth ulcers, including the aphthous ulcers or the traumatic ulcers. You will get immediate pain relief with the laser and the healing is much faster. Apart from this, we can also use lasers to excise any lesions, any small swellings in your mouth, which can be excised or sent to a biopsy with these lasers. The advantage being there is absolutely no bleeding. So lasers can be used even in temporomandibular joint disorders, facial pain or the jaw pain which you have, or even the neuralgic pain. It is more efficient in relieving pain quickly and more effectively. Apart from that, we also use lasers to treat periodontitis patients. Periodontitis is the 6th most prevalent disease according to World Health Organization. 6th most prevalent disease means millions of people have been affected with periodontitis. But many people don't notice such things because it's a silent disease and it gives you pain only at the last stage. How do you notice that you have a periodontitis? What are the symptoms? If you notice that your teeth are becoming weak or it's moving away from its position, or if you notice some bleeding while brushing, bleeding from the gums, or any dull continuous pain while chewing your food, you're not very confident on that, then you might have a periodontitis. Just don't ignore these symptoms. Please immediately meet your dentist or any periodontist. So please don't ignore such symptoms. Please meet your dentist or a periodontist immediately, because these problems may not only affect your mouth but overall health in general. There has been researches which show that the bacteria which is responsible for periodontitis is also a major culprit in causing heart diseases. So please don't ignore such symptoms. Periodontitis basically it's just an inflammation which causes surrounding the tooth. Whatever surrounds the tooth, like the gums and the bones, the inflammation in it is called the periodontitis. So how do we treat such a condition? Normally, traditionally, what we have been doing is to open up a flap. Like what we normally do, we just open up the gums, clean your gum side, which is called the curettage, and clean your tooth side also, including the root. It's called the root planing, and we normally stitch it back so that it will form a new attachment. That's what we have been traditionally doing so far. But what has changed with laser is nowadays we don't open up the flap yet, and stitches is not required also. So with the laser light we kill all the bacteria in it. It targets the particular bacteria, the lasers, and thoroughly eliminates the bacteria inside that pocket. So the healing is much more effective, and the procedure, the time taken for the procedure itself, it's cut down into half. Previously what we used to do is a procedure will take a time of around 1 hour. Now we finish the whole procedure in half an hour's time, and healing, believe me, is much more fantastic than what I have seen in the previous years. So with laser we are able to achieve a best clinical outcome without pain, without any complication. The laser has made things much more easier for the doctor as well as for the patient. Lasers are very fast, it's very simple, and it is very precise. Thank you.